Well, welcome to another episode of Touching Lives from Life Touch Health. My name is David Edwards. I'm the Director of Communications for Life Touch Health. And today we have a very special episode for reaching underserved communities in Arkansas. And today we're going to talk about that not as a statistic, but as people, family, caregivers, churches, rural towns, neighborhoods, and seniors who may not always know where to turn to for help. And our first guest today, we're very pleased to have, is our own Vice President and Chief Operating Officer, Dr. Jessica Ellis. She brings more than 2 decades of experience with her to Life Touch Health in healthcare operations, leadership, and organizational performance. She has quite an extensive academic background on this topic today, and specifically in Arkansas. So, Dr. Ellis, thank you so much for being on Touching Lives today.
Thank you for having me.
Well, let's just get right to it.
Okay.
When we say underserved communities in Arkansas, who are we talking about?
So, of course, we're talking about our minority populations, but Arkansas is such a rural state that we have several individuals who are low SES or socioeconomic status that makes up a great deal of our population in the state of Arkansas. So those individuals will be included in that, but it's those that have barriers to education, health care, services that they need to have a quality life.
Excellent. Before we talk about solutions, I know you gave us an informative overview right there. Do you have any points of data to help put this in perspective for the people watching?
Not so much points of data, just because I wanted to keep it very relatable. But I will tell you, our Hispanic and our African American population in the state of Arkansas, that's usually the ones that are most impacted. Those are the ones that we talk most of when we talk about underserved communities and those who lack the resources. And so that's our biggest population, and you'll see a lot of groups focus on those populations. However, as I conduct my research and in my world of working, for us, it would probably be all of those that are on the outskirts of the major cities like Bentonville and Fayetteville, and of course, Little Rock.
Right. And I know if you look at the Life Touch Health service area map for both hospice and palliative care, we cover a lot of rural area in the state. In fact, I think, isn't most of our coverage and service area predominantly rural or classified as rural?
Yes.
And so that's a challenge from a standpoint of the expense of providing care, the time to respond, and so forth.
Yes.
And we'll touch on that a little bit more later. Let me ask you this. From your experience, what would you say, and what you've seen as the most common barriers that keep people from getting care early enough? Trust, really.
Trust, absolutely. Working throughout the state, what I found was there's always a mistrust of Little Rock facilities. So coming from UAMS, there were a lot of communities who did not trust UAMS. And so if you don't trust something, do you try something? Secondary, I would say knowledge. You just don't know what resources are available. You don't know what resources you need. And so to even learn that information, you still get back to trust. And so education, knowledge, and trust would be my top 3.
So that really comes right back to your opening statement about the challenge of the underserved communities, the information, education, which is part of the reason we have this podcast, is to try to address these issues. So your academic work is focused on communication with rural minority patients and in particular African American populations. What did that teach you, or what did you learn about earning trust before someone is in a crisis? How can we do a better job of that?
We have to be in the community. We have to be a face in these communities before we are needed. So you can't show up in a crisis state or when something is needed and expect this population to listen or to trust you. You have to be engaged with them from the very beginning. So getting with the faith-based organizations, which is a staple in African American communities and most minority communities, is going to be integral. Getting individuals who look and talk like them. So there are communities that look like me, but I wouldn't be accepted in. because I don't speak the same jargon. I don't walk the same. I don't understand their walk of life. So you have to bring in people who understand and want to understand that population. And that's not always possible, right? So then we team up with local leaders. We team up with the pastors in those areas and allow them to say, she's okay, he's okay. You can trust them. You can, depend on their information. They are safe.
Okay. And my next question, you really led right into that, which is what role do local voices play in reaching underserved communities? I think,
It is huge.
Yeah.
It is huge. And, at one point there was a bit of information that was out there, a bit of research that kind of said that faith-based organizations no longer hold that. But there has since been data to show that that is not true. So that's been dispelled. It serves a great need in the rural populations. And so even if we look across Little Rock, it still serves. So we're not as much rural. We're considered the city. But even in Little Rock, with certain populations, certain pockets of individuals, we still need to lean on those local leaders and those faith-based organizations.
Okay. Well, you mentioned local voices that are understood. Well, we're going to take a break, and when we come back, we're going to hear from a couple of those local voices out in our service area on this topic. Thank you so much.
Healthcare is changing, and Arkansas Hospice is changing too, impacting more lives in more ways. Since 1992, our trusted team has grown into the state's largest nonprofit provider of hospice care. Now, we've expanded our services into personal care, primary care, and palliative care, all with a new name, Life Touch Health. Because when patients and families need more from us, we become more for you. Life Touch Health.
Well, welcome back. And as promised, we have two guests with us from out in the field of the Life Touch Health service area. We have Luther Harris, area manager for El Dorado, and Kaylin Shelton, area manager for Pine Bluff and Monticello. Thank you so much for driving in today and being on our podcast. From the information that you just heard Dr. Ellis talk about, what would each one of you say are the challenges that are unique to your prospective communities, both your personal community, your relational community, and your geographic community?
I would say that trust is number one. In my community where I serve, those in that community want to be able to know that they can trust what the information that is given is information that is going to be beneficial for their care. And so a lot of times what I see is that that door is, if you will, it's not open. They won't allow you to connect and come into their space or into their lives because of the fact that when I first started at hospice in 2011, one thing is the H word, hospice. And when you said that we were hospice, first thing people would say is, I don't want that. I used to hear a lot in my years of being at hospice is, well, y'all got that stuff, y'all gonna give us something and my mom is gonna die. She's not dying yet. And so through the years, we have to be able to educate them and be able to help them be able to understand that we are there to provide care, to keep them comfortable, love on them, show compassion to them. And it took time because even now it's still not where it needs to be, but it's better than what it used to be in our communities.
Okay. Caitlin?
I think since Luther led with trust, I'm going to lead with knowledge. I think in my communities that I serve, it's just like a knowledge deficiency with hospice and palliative. I think, if we start doing more panels and things like that, we can kind of lighten that curve. But a lot of people just don't know. They just don't know. Like hospice, like you said, Luther, it automatically scares them. And so if we're overly pouring into the community and telling them like, hey, this is what to expect, this is what to do, and just give them that knowledge, I think we'll have better outcomes.
You just mentioned that it's a little better than what it has been in the past, but we can all agree we have a long way to go still. But let's talk about some recent wins. Can either one of you cite some wins that you see in reaching communities, underserved communities?
Well, I would say that some wins, when I look at our census in our El Dorado location, in the African American community, we have been able to connect with a lot more. They, based upon the care that we provide, the town where I live in, everybody knows everybody.
Mm-hmm.
So if you give good care, if you are doing what you should do, and that go back to what I said earlier, trust, then that person knows that next person that's going to need hospice care. Say, for example, that may be somebody in the community that needs hospice care, and the doctor has recommended hospice. They're going to go ask people in the community, what do you think about? What do you feel about this? What do you think about hospice care? And so I just believe that when we are in our communities serving them and being able to give them what is rightfully that we ought to do as individuals in the calling that we are called to do, I just believe that that helps out a whole lot.
Luther, let me ask you this. You have a life of ministry in more ways than one. You have a ministry with what you're doing with Life Touch Health, but you also have a ministry from behind the pulpit. Do you have any comments, or what would you like to say to any African American pastors that may be watching this podcast?
Well, what I would like to say is that for our African American pastors to share with their parishioners, to let them know. But first of all, they have to be able to have the knowledge. They have to be able to know what is hospice about. We have to be able to sit down and listen to them and hear their questions and what do they already know about hospice. And I think that once we go in and be able to answer those questions, then they will be able to serve their parishioners. Because the thing of it is that even where I pastor, my parishioners not going to listen to someone else, but they'll listen to their pastor. I've been there almost 20 years. And so when I go in there and share with them and be able to connect with them, there's times that even since I've been a pastor, that there has been members that needed hospice. And so when they was at that point, when their physician told them that you need hospice, the first thing they did was call me.
Yeah.
And I was able to connect with them, explain to them. So I just think that if we sit down with pastors and hear their questions and educate the pastors, give the pastors, go back to what Kaylin said, knowledge and a broader understanding of what hospice is about, instead of being able to just say, hey, you need hospice. And when you say you just need hospice, and we make that phone call, the first thing sometimes they say is, especially in the African American community, oh no, I don't want hospice. But I just believe if we connect with pastors, connect with them, give them that information, I think we'll be able to unlock that door.
Right. And maybe that's where palliative care can come into it too, is it can be a first step to say, look, this is not hospice. You can still get your curative treatment, but it's a first step in providing that needed care for the family, for the patient and the caregiver too. Kaylin, let me ask you this. You're an RN, you're also a daughter, and you're a woman. And we all know that it's the daughters and the women across all communities who are the primary healthcare decision makers. But from your perspective, what would you say is again the biggest challenges related to what Luther was talking about earning the trust? How do we do a better job of that?
I think we just have to know our community. I mean, it's just circling back to knowing our community and what's what they need in the community. Having someone that they can associate like Touch Health with, somebody that they can trust. And then too, David, you mentioned a win. And I kind of want to circle back.
Yeah,
to
please.
because I really want to give a shout out to our foundation, because our foundation has truly made us win in the areas that I cover. It's very rural, even if it's just a simple lawn mowing. They come out and mow lawns. The foundation may just provide the gas for the lawnmower, and then the volunteer department also wrap in with that because they can
Mm-hmm.
get a volunteer to do it. So that's a win for us in those rural areas that I serve. Just helping those families. It can be something simple as giving the patient an air conditioner, but the
Mm-hmm.
foundation look out. So
Yeah.
that's a win right now.
I totally agree with that. Totally agree with that. Well, thank you so much for both of you being here today. This has been very informative, and we're going to hear more as time goes by with future episodes from other leaders that we have and clinicians out across our service area. So with that, we're going to take a quick break, and we'll be right back.
Healthcare is changing, and Arkansas Hospice is changing too, impacting more lives in more ways. Since 1992, our trusted team has grown into the state's largest nonprofit provider of hospice care. Now, we've expanded our services into personal care, primary care, and palliative care, all with a new name, Life Touch Health. Because when patients and families need more from us, we become more for you. Life Touch Health.
Well, welcome back. Life Touch Health now, talking about this organization, it now represents more than just hospice care. Everyone should know, but we want to remind everyone that has been Arkansas Hospice becoming Life Touch Health. How does having these additional services help under one name help our families who may not know what kind of support they need?
So, in communities, and I'm just going to say across the board, you hear the word hospice and it frightens you. When you have someone who is at the end of life, we don't want to face that reality.
Right.
We don't want that to be our reality. And specifically for African American communities, that is a no word. They hear that and they think that we're going to rush their loved one to death. And so changing that name actually gives us the ability to start a conversation, because if they
Right.
hear Arkansas Hospice, we don't get to start the conversation. So I think the name change will help us to getting to these communities. But with all of our service lines from personal care doesn't have to be someone who's end of life. It could be someone who had a knee surgery that is
Right.
perfectly fine and has years, before them.
And we've had we call them clients, but we have had clients that are early part of middle age, and they just had maybe a knee replacement, and they just need someone to come
Just a little
help take out the trash, feed the dog, go check the mail, those types of things.
Absolutely.
Yeah.
And then we think about primary care. All of us seek primary care, but there comes a point sometimes in your life where you can't get up and get out of your bed and get out of your home to go to an office. And so we have clinicians who work with us that will come to you. We meet people where they are. And so that's just your general primary care service that we can provide in home for those who can't. And then palliative care. So that's a word in our community that still scares. Palliative, hospice, same thing, no difference. But what that is giving you care when you have a chronic disease, even when you have something that we won't heal, but you're not going to.
It's not imminent.
No, it's not imminent. It's not. Death is not up on you. We can provide services that add quality to life. And we see that individuals have a better quality of life and a longer life sometimes on these services. And so dispelling that palliative care is hospice care is critical for us. And I think that's something that we need to focus on, because there is so much care that can be provided, and not just for the patient, but for their caregivers.
Right.
Respite care, to give the caregivers a break. That's important. And in minority communities, we take pride in taking care of our own. And when we have to let someone into our space to take care of our loved one, we feel as if we failed.
Yeah.
And so letting them know that you haven't failed, you're doing a good job, but it's important for you to take care of yourself, because data does show that sometimes the caregiver is the one that goes first
Right.
because of the added pressure and stress. So, and then of course we have hospice care. And personally, I've seen someone die with hospice care and I've seen someone die without hospice care. And they're two different worlds.
Mm-hmm.
And with the person, which is my grandfather who died on hospice care, was one of the most beautiful things I ever experienced. He was pain-free, he was comfortable, he was surrounded by family. He had individuals, their clinicians who cared about him. We had bereavement services, we had social services that took the burden off of us. And so helping the communities to understand that it's more than just helping them die, it's helping them die with dignity
Right.
and with love and, with the least amount of pain as possible.
I hear stories walking up and down the halls, talking with clinicians and the bereavement specialists, and a recurring thing that we hear over and over and over again from the family members are, I wish we would have called sooner. Both for hospice care and for palliative care, as far as that goes. One other thing that I know that I would like for us to touch on with palliative care, and a difference between it and hospice care, is you can still be receiving curative treatment
Yes.
with palliative care.
Absolutely. It is not the end. It's not just a comfort level care, but you can still receive your treatments.
It's just an added layer of care coordination
Absolutely.
and symptom assessment right there. So let me ask you this, for seniors who have difficulty traveling to appointments, going back to that, not only the primary care, but all of our service lines, but how can primary care where they live close help close that access gap? And I know one of the things with Life Touch Health is we're really focusing on primary care in senior living communities. Tell us about how is that working where we go into a senior living community where maybe they have several layers of care. But now, if I understand it correctly, we can enhance the care in those facilities. We can partner with these facilities and have a greater outcome for the patient, the facility, both.
Mm-hmm.
Yeah.
So, it's a care that we can provide to keep them out of the hospital.
Okay.
And so we keep them there in that facility longer. We can work with them in their home or in their room without them having to leave and be hospitalized. There are certain risks that come with hospitalization. And when you think about a patient, especially someone with dementia, if you take them out of the environment that is familiar to them, we can actually do more harm. So allowing us to come in and provide those primary care services really is a burden off of the patient and their family and the facility as a whole.
Right. Let me ask you this. I want to ask us to look not only inward with Life Touch Health, but maybe other care providers, both in this market and other markets that may be watching this. What about reaching underserved communities has to happen behind the scenes? What do we as the providing segment of this, what do all of us have to do better to reach these underserved communities?
I think we have to understand the communities. And we have to be sensitive to their culture. We have to respect their culture, whether that's religion and whether that's their family beliefs. We have to respect it. And to respect it, we have to understand it. We also have to employ individuals who can relate to this population. So I always say that our workforce, our leadership should be representative of the communities in which we serve.
Right.
And so that's where we're going with Life Touch Health. We are bringing in those who can serve our patients better. We're learning about our patients. We're learning about our communities. And then we are ourselves looking introspectively so that we can provide that level of care the way that they need it, where they need it.
Right. You have a background where you have led large-scale operations across the entire state in more than one instance. Mm-hmm. How do you balance maintaining consistency but yet the local sensitivity and that local flavor in various locations? Because we all know Arkansas is, even though it's not a huge state, culturally, geographically, it's very diverse. Absolutely. So how do you balance that?
You're always going to have your regulations. You're always going to have things that you have to do to keep us operating. And we always have to look to that and we have to abide by that. But we also have to learn our communities. We have to know our communities, and we have to get out of self. And so, you always try to go in with a respect, with I'm here to learn. And you can learn every day. One of the things I tell my team is to question everything. I don't care if you came up with the concept, question it, because things change, needs change. And so I always try to keep that perspective. It's less about me and it's more about those that I serve. At the end of the day, that's our goal. Everything else will fall into place, but our focus is our patient and our families in the communities in which we serve them in.
Right. Well, I know that many underserved patients rely heavily on family caregivers. And you mentioned that earlier, that especially among African American communities, there's this sense of, if I'm not doing it all, I'm not meeting my obligation. I'm not what I'm supposed to be as the family. What do those caregivers need most from Life Touch Health? And maybe what do they maybe not understand most about what Life Touch Health has to offer to these caregivers?
Not many people know about respite care. Not many people know that you can send your loved one away for a bit, or you can have a volunteer that can come in and sit with them. So you can go out and go to the grocery store, or go for a brisk walk, or, sit outside. You may not even leave the home, but just to go and take a shower or sit outside and enjoy a cup of coffee. And that doesn't take away from the care that you give and the person you are and how much you love that
It's
individual.
going to make you a better caregiver.
Absolutely, it will. So Life Touch Health provides that. But I also want to touch on our bereavement service. So we talk about grief, and grief is such huge. So, mental health in minority communities, we don't address it the way that some other communities do, because it's almost, if we look at our religion, God will take care of it. He'll make a way. And so we don't seek those mental health services, but it's so important because grief can start before a person leaves this earth. You can grieve what used to be. You can grieve the person that is fading before your eyes. You can grieve the life that you had before you became a caregiver. And we have individuals who can help you through that. So even while you're in the home taking care of your loved one, we have individuals who can come in and who can provide a relief just by talking with you, by sitting with you, by sometimes just getting it out is enough. Just saying it out loud is enough. And Life Touch Health provides that service.
And we've just got to do a better job of letting everyone know that.
Educating and informing,
Right.
Absolutely.
Let me ask you about some other aspects. You mentioned grief support some there, and I'd like for you to expand on that. What about our grief support, pediatric care, and veteran services? How do those fit into the conversation about underserved communities?
So, we have a large vet population in the state of Arkansas, but we don't always take good care of our vets. But here at Life Touch Health, we value them. We have programs for them. We try to celebrate them on the days that they need to be celebrated and the days that are not national holidays. And so we do take special care of that population because they mean so much to us as we come up on, the holiday where we're celebrating who we are as a nation. Those individuals, we owe it all to.
Yeah.
And so at Life Touch Health, they hold a very special place in our heart. And so we do our very best to take care of those individuals. And as it relates to pediatric patients, that's probably the hardest population to take care of because it's hard to watch a child suffer. You asked the question, what did they do to deserve to be here?
Right.
But we do have services that take care of those individuals. And again, it's not just that patient, it's their siblings, it's their parents, their grandparents. And so we wrap them all and we take care of them all as they navigate probably the toughest period in their life.
I know one of the things that is a benefit of the pediatric care that maybe our viewers may not know about is that there's a special provision in the hospice benefit for pediatric patients that they can still be receiving curative treatment the entire duration of the treatment plan. Not like adults, you have to be 6 months or less and projected lifespan. But for pediatrics, you can still be pursuing every curative option and receiving the additional benefit of what hospice do with the additional support and layer of support. Starting to wrap things up, how would you define success 2 to 3 years from now if Life Touch Health reaches underserved communities in the way you think we can? In other words, where can we go from here? What would you define as a good next step?
We need to get into the communities. We need to get into the local churches. We need to inform them, be a part of their health fairs. Go in. Sometimes they allow you to come in on Sunday service. We need to be present. We need to be a part of their community. And then when we are receiving phone calls from these underserved populations saying, I need help. I don't know what I need, but I need help. And allowing us to help them navigate where they fall in our service line, that's going to be successful. When we have more of this population receiving treatment, getting the services that are available to them, knowing what their options are, I think we'd be more successful. When our workforce is representative of the communities in which we serve, we will be successful.
We've got to represent and we have to listen.
Absolutely.
Okay. Well, thank you, Dr. Ellis, and our other guests for being here today. If you, as a watcher, if you have another topic that you would like some information on, if you're a caregiver or if you are dealing with anyone with serious illness, please contact us. You can go to contact us at lifetouchhealth.org. Send us an email. If you just want to go to lifetouchhealth.org and look at all the resources there, click on the Contact Us button. You can still get in touch with us there. Thank you so much for watching. Please share this with your friends and anyone who may be dealing with serious illness or just a way to live better. Thank you so much, and we'll see you again on Touching Lives.
For more information about Life Touch Health, visit lifetouchhealth.org. And please subscribe to our YouTube channel, like this video, and share it with someone who may benefit from today's conversation.